Hey guys, you are watching Inside the Fights. I am your host, Ashley Luther. We are here at Marietta Physical Rehab. I am sitting here with the man who won Sponsor of the Year. Guys, if you're feeling depressed, have a low sex drive, difficulty concentrating, have erectile dysfunction, nobody wants to admit that, but fatigue, decreased muscle mass, hair loss, you need to come and see the man himself. I'm talking about Dr. Jason Weeks. Jason, love to have you on the show. Thank you so much for coming.
And thank you for having me, Ashley. It's good to see you.
Now, Jason, you've been involved in the MMA community for about 10 plus years. Tell me how you got started and how that experience has got you to where you're at today.
I got involved with the MMA community here in Atlanta kind of by accident. A gym opened up across the parking lot, X3 Sports. We hired a young man to do some local marketing for us. Apparently it hadn't occurred to us to walk over and shake hands with the owners. So the young kid came over and said, hey, I've got something set up with the gym that's across the parking lot. So we went over and spoke with him and indicated an interest in just being able to help out their clients and their members. And they immediately kind of made it clear that they would rather be doing business with members as opposed to just people that happen to be close by. So there was an agreement made that we would kind of go in there and check out what they did in return for doing the same. So Dave Vitke was one of the lead instructors over there at the time, who we happened to know each other from outside the gym. And I was taking a kickboxing class, and wasn't really into it. It was kind of kick in the bag wasn't really my thing, and I was enjoying the view in the class with some of the younger ladies that were participating more than anything else. But the jiu-jitsu guys were on the mat next to me, and I started watching what they were up to and realizing that might be a better fit for me. And Dave Vitke was kind of instrumental in that. He grabbed me and walked me into the manager's office at the time and insisted that I buy a gi, so I threw my credit card down, and I've been training with Hanieri Pava ever since, and that was about 9 years ago.
Awesome. So what belt are you?
I'm a brown belt under Hanieri.
Awesome. Cool. So TRT, testosterone replacement therapy, is actually a hot topic in the MMA world. Tell me a little bit on how this has helped some fighters become more disciplined, and what potential they have received from doing testosterone replacement therapy.
So there's a lot of misconceptions in the MMA world because of the laws and the rules that the UFC imposes, or the athletic commissions from state to state impose on the professional fighters. So that's probably important that we touch on that before we even start talking about what the program does. What we do here in the office is safe. It's legal, unless you are participating in an event or a promotion that clearly defines the legality or the issue with clearly stating that it's not legal to use it. That's come up with several of the fighters that have been banned for a year or been caught using TRT. For the average athlete, it's not illegal, and it's a safe way to change your physiology so that you can recover faster, you can build lean muscle mass, your libido goes up. There's a lot of things that you wouldn't normally associate with low T that bring about very profound changes very quickly once you're using the program.
Now, kind of touching back on what you just said, now how it can help build muscle mass. Some people have the misconception that someone on TRT is going to have a muscle building advantage than somebody who's not on TRT.
And that's not necessarily untrue, but being that it's a legal alternative, what you're really doing is you're changing your blood physiology back to where it was when you were producing a higher level of testosterone. So what we're doing is going in and supplementing it and changing the older gentleman's blood physiology back to where it would have been when they were, say, in their early 20s, and enjoying the benefits that brings. And those are both physical and mental changes. When you have somebody that doesn't feel like getting out of bed, depression can come with it. chronic fatigue. Usually that's related to lack of sleep. So there's a lot of symptoms with low T that you wouldn't normally associate with a hormonal imbalance that are affected immediately and bring about some very abrupt changes in a positive way for the athlete that's using it.
Hey guys, we're going to take a quick commercial break. When we come back, I'm going to do word association with Dr. Weeks, and we'll see on how that turns out. Stay tuned. Have your focus and concentration at work begun to slip? Are you running out of energy far too early each day? Are you experiencing muscle loss or gaining that stubborn belly fat? Or is your romantic desire just not there anymore? Stop assuming that feeling like this is just a part of getting older. These symptoms are signs you may have low testosterone. Our medically supervised low T therapy can help you get back to your old self again quickly and safely. Call us today. This could be the most important call you make all year. All right, guys, we're back. You're watching Inside the Fights. I am your host, Ashley Luther. Dr. Weeks, what would be the cutoff age limit for somebody who is feeling these symptoms, but yet they may be in their 20s, coming in saying, I'm feeling this? What would be the cutoff limit that you would offer somebody testosterone replacement
So the
therapy?
primary candidate for testosterone replacement, we start at 30 as a cutoff in regards to age. Symptoms typically include fatigue, depression, unwanted belly fat, loss of libido, sleeplessness. There's kind of a laundry list of symptoms, but those are some of the bigger ones that usually tip you off that low T is an issue for that person. We know that the body's natural production of testosterone does start to drop off after the age of 30, so that's a starting point in regards to bringing them in and at least evaluating their labs to see if they're a candidate that would benefit from using TRT.
Now, I know you've answered a lot of questions so far, but for somebody who's a little hesitant on getting testosterone replacement therapy, is dealing with these symptoms, why should they try testosterone replacement therapy?
You know what? The best answer I have in that regard when I'm dealing with a patient that has questions about safety or some of the negative things that are heard about it. There's class action suits out there. Most of those are coming from the irresponsible use, either in the gym on their own, which we get a lot of patients that finally decide that they'd like to do it more responsibly, to primary care physicians that aren't monitoring labs the way they should. So we have a very good clinical program in place that evaluates labs, makes sure that the candidate is a safe candidate for TRT, so that it doesn't cause other physical complications. We're very acutely aware of their labs in the beginning, and then we're monitoring those labs on a regular basis to make sure that there aren't any unwanted changes. All the changes that we are looking for should be positive. So we're very good about making sure that the monitoring is done correctly, so that it doesn't arise that they don't have physical complications as a result.
So guys, if you're feeling any of these symptoms, come and see Dr. Weeks. He can definitely help you out. North Atlanta HRT, and also here at Marietta Physical Rehab. Now, Dr. Weeks, how much would testosterone replacement therapy actually cost somebody?
So we've got a very affordable program. That's usually everyone's primary concern is the cost. We have designed our program to make it affordable for people that everybody's heard of Cybergenics down in Florida. That's the ad with the guy in the in-flight magazine that looks 80 years old, but he's all jacked up. We have actually duplicated their program in regards to the clinical protocols, but made it far more affordable. Down there, I think you're paying anywhere from $1,500 to $2,000 a month.
Oh, wow. And
we're offering the same program for less than $300 a month. But for $99, you can come in and get your labs done, see if you're even a candidate, and then we'll take it from there.
Now, if somebody was interested in contacting you, how would they be able to get in touch with you?
They can go to NorthAtlantaHRT.com or call me directly at 678-471-1292.
Now I'm going to do word association with Dr. Weeks. Dr. Weeks, I'm going to say a few names. I just want you to say the first thing that comes to mind, okay?
Absolutely.
All right, we got Donald Trump.
Comb over.
Hillary Clinton.
Prison.
X3 Sports.
MMA Mayhem.
Ryan Gibson.
Douchebag, douchebag, douchebag. Douchebag.
How about George Kinnebrew?
Interviewer extraordinaire.
Ryan Gibson.
Not sponsor of the year.
Not sponsor of the year.
Not sponsor of the year.
Thank you guys for watching this interview. Please, if you feel that you have any of these symptoms with low testosterone, get in touch with Dr. Jason Weeks. He has given you his contact information. Again, this interview is being brought to you by North Atlanta HRT. You are watching Inside the Fights. I am your host, Ashley Luther. Stay tuned, and hopefully we'll see you again next time.
Thanks for having me, Ashley. I appreciate you.
Thank you,
Good to see
Jason,
you
for
again.
being on. This is awesome. High five.